In order to get into the thoracic cavity, what you're going to need to do is cut along the midline up here, and this is illustrated on page 61 in the book, and then you're going to go lateral. Once you've gone through all of the ribs, you're going to go lateral towards the arm. After you've done that, you have to make some cuts to the diaphragm, because the diaphragm is attached to the rib cage, so you've got to cut it off of the ventral portion as well as the lateral portion. Once you've cut the diaphragm away from the rib cage, then you're going to have to take both hands and break apart the ribs. You're just going to open it like you're opening a book. Once you have opened up the rib cage, this is what it should look like. The next thing I'm going to do is I'm going to start cutting up towards the neck. Once you've cut open the skin on the neck, you're going to need to peel back a lot of this muscle, and then you'll be able to find the thyroid gland, which is this dark fleshy lobe kind of above the lungs and heart. Then you've got the larynx, which is this hard portion. It's pretty wide and big. It's very distinct when you look at the neck. Now, as you travel down this tube, you have the trachea. You can recognize the trachea because it's ridged, so as you rev the probe, you'll be able to feel like bumps and ridges. So right here is your heart, and you can see that there is like this sac that is containing the heart. That sac is called your pericardium, so you're going to want to get a picture of your pericardium before you move on. Now above this is actually your thymus gland. You don't really need that, so don't worry about it. Now, one thing to keep in mind that gets a little confusing is right and left side. Whenever we talk about right and left, we're talking about from the pig's perspective. So if we say right atrium, even though this looks like it's left to us, it's right on the pig. So keep that in mind as you hear these next terms. Also, the lungs. Here are the lungs on both sides. Right, there's several lobes on them. As you guys were opening up the rib cage, you probably saw like a clear filmy layer. I can't see it on mine, I already took it off, but that's called the parietal pleura. It's basically a connective tissue covering that kind of keeps everything lubricated because there is some movement of these organs. So the area, the space where the lungs are, is called the pulmonary pleura. So probably before you open up the ribs, you might want to take a picture of that cavity where the lungs are and label that the pulmonary pleura. So what I'm going to do now is I'm going to take off part of this thymus gland, and I'm going to take off my pericardium so that we can look for the ventricles and atriums in the heart, as well as find the arteries and veins that we need to find. So the next things that we're going to try and find are all parts of the heart. So the first thing is finding the right atrium, which is where blood enters the heart. So see this like darkish portion right on the heart? That's the right atrium. Right below it, we have the right ventricle. We've got our left atrium, only it's on the other side, and then we have our left ventricle here. So that's all that we need from the heart. For the arteries, we need to find the aorta. So the aorta is the artery that takes the blood to the rest of the body, and it's actually set up and looks like an arch, so we can kind of see that whitish portion right here. The pulmonary artery, which is more ventral, is going to go to the lungs. All right, so pulmonary artery, aorta, and the last one is this pink right here, which is our coronary artery, the artery that's serving our heart. What we also need to find are the veins, which bring the blood to our heart. Over to the side a little bit, there is a blood vessel. Push it. to the left here. You see this blood vessel right there? That is my inferior vena cava. All right, so it is kind of below. Actually, inferior vena cava is what we call it in humans, but in the pig, it's actually called the posterior vena cava. Now, those both feed into the right atrium, or that one feeds into the right atrium, and then also feeding into the right atrium is the anterior vena cava. Sorry, but it's going into the right atrium, and it is basically coming from the head in the upper region, so it's kind of right there. In order to find the esophagus, you're going to need to move the left lung, which is your right, to the side. And this right here is not your esophagus. This is actually part of the aorta as it comes down. So the esophagus, there it is, goes through the diaphragm, and here it is. All right, so it'll have a little bit of tissue kind of holding it in place towards the back, but that's it.